Hello everyone, this is Vamshi Krishna. So today we are going to discuss regarding some of the important questions for the upcoming Telangana staff nurse recruitment examinations. So the first question is, what is the gauge of spinal anesthesia needle? So here you are seeing the needle which is used for the spinal anesthesia and LP. LP nothing but lumbar puncture. So LP is doing for the to diagnose the any uh, diseases like meningitis and to find out the pressure of the CSF fluid and okay, some of the diseases related to the central nervous system we can use or we can do the LP procedure, that is nothing but lumbar puncture. So the options are option A 23 gauge, option B 26 gauge, option C 21 gauge, option D 22 gauge. The right one is the option A 23 gauge. So anesthesia needle is a 23 gauge size. So the next question is a antidote for OP poisoning. OP poisoning nothing but insecticide chemicals. Okay, when the person is ingesting of insecticide chemical which is known as the OP poisoning, opioid poisoning. Option A atropine, option B adrenaline, option C pralidoxim iodide, option D neostigmine. The right one is the option C. It is known as palm. Okay, other name for the pralidoxin iodide. It is used for the opioid poisoning, nothing but OP poisoning. The next one is identify the thing what you are seeing on the screen. Okay, so if you seeing this picture, can you guess the name of this item which is used in the intensive care unit? This is nothing but when this is nothing but ventilator circuit. Okay, nothing but it's a pipe which is connected to the ventilator machine, and it is and the other part is connected to the ET tube of the patient. So if you see here, this is nothing but test lung. Okay, test lung, it is used to find out the mechanism or functioning of the ventilator machine. So this is nothing but ventilator circuit. The next question is a use of albendazole medication. Albendazole medication. Option A, it is antihistaminic. Option B, anti-emetic. Option C, analgesics. Option D, antagonist. The right one is a anti-emetic. So this medication is anti-emetic. It is nothing but it is used to prevent the parasites in the intestine. Okay, intestine, that is nothing but worm infestations. Okay, for all this disease condition we can use albendazole medication. The next one is identify the picture showing on the screen. This is three-way cannula. Okay, this is three-way cannula. So it has the three parts which is it is connected to the IV cannula, and we have the two parts here. So by this we can give the injection. Okay, it is nothing but three-way cannula. The next question is surgical gloves contain the powder. Okay, so if you observe the surgical gloves, inside we can see some white color powder. What is that name? Option A, borax powder. Option B, nitric powder. Option C, sulfuric powder. Option D, cornstarch powder. So what do you think? Option D is the right one. Corn starch powder. So it is the function of this powder, which is present in the surgical gloves, to easy to wear. Okay, to easy to wear to the hand. So the name of the powder is corn starch powder in the gloves. Mostly it is used for the rubber materials. The next one is a indication of injection mannitol. What is the use of injection mannitol? Nothing but medication. Option A, to increased intracranial pressure condition when the person having the increased ICP. Option B, to increase the urine output. Option C, brain edema. Option D, all of the above. The right option is option D, all of the above. So in the case of intracranial pressure, or to improve the urine output, or in the condition of brain edema, we can use the injection mannitol. The next one is cord blood nucleated red blood cell count. Okay, cord blood nucleated red blood cell count is to be find. What is the use of diagnose or analysis of the cord blood nucleated red blood cell count? Options are fetal growth, fetal asphyxia, cervical dilatation, cord blood analysis. What is the use of doing the test of cord blood nucleated red blood cell count? It is used to find out the fetal asphyxia. Fetal asphyxia. Asphyxia nothing but decreased O2 saturation in the blood. That is asphyxia. Next question is complication of placenta previa. Option A, uterine bleed. Option B, lower abdominal pain. Option C, antepartum hemorrhage. Option D, postpartum hemorrhage. The right one is option C, antepartum hemorrhage. Why? Because placenta previa we can observe in the pregnant women. Okay, during the pregnancy, when we observe any bleeding, that is known as the antepartum hemorrhage. Along with this, we can see uterine bleed and lower abdominal pain or postpartum hemorrhage after the delivery. So, among these four options, we can choose the first one, first priority, that is antepartum hemorrhage. The next one is placental end of the cord consists of divergent umbilical vessels surrounded only by fetal membrane. What is the name of this condition? Option A, velamentous placenta. Option B, abruptio placenta. Option C, short cord. Option D, cord knot. Cord knot nothing but knot we can observe of the cord, umbilical cord. The normal umbilical cord is like this. Okay, when you observe the knot of the umbilical cord, okay, that is known as the cord knot. అంటే ముడి వేసినట్టు ఉండటం. The right option is a velamentous. Velamentous is the right answer. Velamentous placenta. Okay, so this is, if you see the placenta, here we have the umbilical cord. The blood vessels which are enter like this, that is known as velamentous placenta. The next one is identify the image below shown. So if you see the picture here, what is the name of this machine? This is nothing but infusion infusion pump. Okay, this is known as infusion pump. So in this infusion pump, you can set the 50 cc or 20 cc or 100 cc syringes. Okay, so if you keep the syringe over here, in the syringe we have to mix the injection with the diluted solution, nothing but normal saline or distilled water. Okay, for example, if you want to give the 0.2 mg or 1 mg for the patient. Okay, by manually we cannot calculate the medication time to time, every hourly or every minute wise. So by this infusion pump we can give the medicine accurate. Okay, we can adjust the, so he on the screen you can set the amount of fluid, amount of injection we have to administer to the patient. So here we can set, this is known as the infusion pump. Okay, infusion pump. So this type questions you can get in the examination. So you must thorough all these instruments which are used in the hospital settings. The next one is the Mistress X admitted with severe burns, 50%. What is the fluid choice for IV administration? For example, when the patient having the burns, okay, so what is your first priority? Give the which type of fluid for the patient? Option A, ringer lactate. Option B, normal saline. Option C, dextrose. Option D, any of these. The right one is option A, ringer's lactate. So why we prefer only ringer lactate as a first priority in the case of severe burns or any burns condition? Why? Because it is a solution that's used to replace the fluids and electrolytes in the patients. All those patients who having the low blood volume, okay, low blood volume and low blood pressure. So in these conditions we can give the ringer's lactate for the patient. This question is already asked in the last year examination of the Telangana staff nurse recruitment examinations. So the next picture is or next question is, what is the name of this instrument? So you can easily guess it is a defibrillator. Defibrillator. So what is the use of this defibrillator machine? Okay, by this machine we can give the shock waves. Okay, shock waves to the patient when the patient having the abnormal heart. Okay, abnormal heartbeat. Otherwise, when the patient doesn't have any heartbeat or any shock, so in these conditions we can give the shock waves to the patient by adjusting the volume of shock waves, that is nothing but volts or nothing but joules. Okay, so in this language joules, we are saying that this 200 joules, 300 joules or 100 joules, like that we can administer the shock wave to the patient. And also this machine have the biphasic and monophasic. Okay, biphasic nothing but by the two handles. Okay, so here we have the two handles. By the two handles we can administer the shock waves, that is biphasic. Monophasic nothing but with one handle only we are administering the shock waves, and also another handle, it is used to receive the shock waves which is coming or coming from the first to second. Okay, so for example, the patient is having cardiac arrest, so we are giving the or placing the handles or plates, nothing but it is also known as pads. Okay, if you administer the shock wave after entering to the patient and it is receiving other pad. Okay, one pad is to administer, one pad is to receiving, that is monophasic. Biphasic nothing but with the two pads we are giving the shock waves, that is nothing but joules voltage. The next picture is, what is the name of this picture, this item? Okay, it is ET tube. Okay, ET tube nothing but endotracheal tube. So this ET tube have the different sizes. That size also measured by the nothing but diameter of the tube. Okay, that is start from the 2.5 to 7, 8, 7.5 like that. So we have the parts here. So here you can observe the bulb. Okay, after inserting the ET tube to the in the lungs or trachea, we have to inject the amount of air. Okay, what will happen, this bulb will be bulge. Okay, it will prevent the coming out of the tube. This is ET tube. The next picture is, recognize the picture below shown. What is the name of this picture? This item, that is flow regulator. Okay, this is flow regulator. This this item is we can use for the regularization of the flow, how much ml of the flow we must give to the patient. Okay, for example 1 ml, 10 ml, okay, 5 ml, that is the flow. Okay, we can adjust by seeing this. Okay, this is flow regulator, remember this one. The next item is a octopus extension. Okay, octopus extension, this item is the octopus extension. So by this we can give the uh, injection by the 3 ports. Okay, 3 port nothing but opening, port, PORT, port. Okay, so this one is connected to the IV cannula, and by this we can administer the injections. The next one, and it is the last question, is identify the diagnose or identify the condition shown in this picture. So by this seeing picture, can you guess the condition? So here we are not seeing the pregnant. Okay, why? Because he is a male person, because he doesn't have the breast. So the abdomen is very bulge. This is nothing but ascites. Ascites nothing but accumulation of fluid in the abdominal or peritoneal cavity. Ascites condition. So thank you guys for watching my video. I hope you all preparing very well for the upcoming exams, and good luck for everyone, and thank you so much.